When you make a decision to go back to full-time education or to education of any sort, particularly if you've been working out in the clinical area for a long time, for many years as I have been, you have to make that decision based on what's going to be good for you, what's going to fit in with your life, what's going to fit in with your family, what's going to fit in with your job and your career. And they were all of the factors that led me towards the uptake of this course. So I'm currently on the diploma with every intention of going towards the master's programme next year. And the course itself fits in beautifully with my life. The fact that it's run over, each module is run over 6 to 7 weeks, means that you can plan every week as to how many hours you're going to give it each week. And you can really work around that and put the time into it really to get what you need back from it. It's a very applicable course to what we do clinically as well, because already I'm 2 modules into it at this point, and I'm already adapting things that I've found that I'm learning through the modules into my clinical practice. And I suppose I'm passionate about the delivery of care to my patients, but I'm also passionate in role modelling how I deliver that care and in educating people that work with me in how to deliver the care. And this course really gives you a very good foundation towards learning the skills and the steps in how to do that most effectively and most efficiently, really for our patients, because at the end of the day, that's why any of us are doing anything that we do in the medical and nursing profession. So the workshops that we attend once a module take place on a Saturday morning, which is really convenient for childminding, never mind for anything else. And they're teaching skills workshops. And basically we all meet as a group. We teach skills that are totally different to what we do clinically. So it could be making paper airplanes, or it could be card tricks or something like that. And when we get together as a group and we teach it, we're able to look at our own teaching skills, our own communication skills, our own style of teaching and how we interact with our students, and we learn an awful lot from it. And it's also very good fun, particularly, for example, today even though I know how to make a bed, but it was good fun to do it with a colleague who doesn't normally make beds, but we ended up being the winners of the bed making competition, which is quite good. It's always nice for your ego. So being a nurse and having worked as a nurse for over 20 years, I really thought long and hard about what kind of teaching degree or teaching diploma or masters that I wanted to pursue. Teaching has always been something that I've been very interested in within my clinical practice. This course sort of ticked all the boxes. It teaches you how to look at your own teaching styles. So it's not that it's teaching you how to teach per se, it's teaching you to look at what you already do in clinical practice and how to make it better for you as the teacher, how to make your students' learning experience better and make it more positive, and ultimately how to make it better for the patient within the area. I also, one of the clinical area that I work in, I have a lot of interaction with parents of very sick children. So that was another area that I really wanted to ensure that I was giving the best to the parents when I was teaching them as well, to look at how was I teaching them and what messages was I giving them, what were they taking home, and how can I ensure that these parents wouldn't be back again by virtue of the way that I teach them. And that's one of the reasons, probably the biggest reason why I chose to undertake this programme as opposed to any of the other multitude of educational programmes that are out there. Particularly within the nursing sphere. So I have to say I'm very glad, I really enjoy it, and I'm very positive about the future with this under my belt.